Take Back Your Health Now, Episode 91. Information contained in this podcast is not medical advice. It is for educational and informational purposes only. Please consult with your doctor before making any health choices.
You're listening to the Take Back Your Health Now podcast, the show that interviews the top doctors, athletes, trainers, and entrepreneurs to help you find the holy grail of health. Now here's your host, Dr. Dan Margolin.
Hi, this is Dr. Dan Margolin with another segment of Take Back Your Health Now, where we pull out all the stops in search of health's holy grail. We're very excited today to have Dr. Paul A. Byrne. He is a board-certified neonatologist and pediatrician. He is the founder of the Neonatal Intensive Care Unit at SSM Cardinal Glennon Children's Medical Center in St. Louis, Missouri. He is clinical professor of pediatrics at University of Toledo College of Medicine. He is a member of the American Academy of Pediatrics and Fellowship of Catholic Scholars. Dr. Byrne is past president of the Catholic Medical Association, USA, formerly clinical professor of pediatrics at St. Louis University in St. Louis, Missouri, and Creighton University in Omaha, Nebraska. He is author and producer of the film Continuum of Life, and author of the books Life, Life Support and Death, Beyond Brain Death, and Is Brain Death True Death? Dr. Byrne has presented testimony on life issues to 9 state legislatures beginning in 1967. He opposed Dr. Kevorkian on the television program Crossfire. He has been interviewed on Good Morning America, public television in Japan, and participated in the British Broadcasting Corporation documentary, Are the Donors Really Dead? Obviously, we're going to be talking about organ transplant and donors. Dr. Byrne, welcome to the show, sir.
Thank you very much, Dan, for inviting me.
Oh, we're really glad to hear you. You know, I've heard you speak before, sir, and I got to tell you, it's such a strange topic. It's something that you never hear of. And when I first heard you speak of it, it was so disturbing that I almost, from an ethical viewpoint, I had to look at it from different ways. And I was just unsure as to, would this be a fit for the show? Is it something that I wanted to bring on? But after listening to you speak, I'll tell you what happened. I was in Texas a few weeks ago, and I got up in the morning and I was watching one of these early morning shows. And unfortunately, there was an accident with one of the race drivers who was a young guy, and his family was on, and you know, the family was saying how he was declared brain dead and how they were happy that he gave his organs and all that. And I listened to their story, and I listened to, you know, they went over how they first heard that the son was brain dead, and you know, how it was presented to them, and how the nurse came in and how she said, you know, the doctor's going to be in shortly, and I just want you to know he's very abrupt, you know, but that's just the way he is. Anyway, it had, when I listened to it, such a feel of a sales spiel, like they were selling this family on this concept of the son being brain dead and that he should donate. It just, having heard you speak before, I just got that there was something more that the family was not really being informed of. And it made me go, no, I need to have you on. I need to speak about this. So anyway, just to give you a little bit of my own sort of conflicts and stuff with this subject. So if you would, Dr. Byrne, just tell us a little bit about yourself. Tell us how you became aware of this whole organ transplant situation, and then just educate us as to what you believe is going on.
Yes, Dan. First of all, I'll reply just a little bit to your introduction. That's a very common scenario, and I've heard it many, many times, how the nurse, and they always describe the nurse as being very pleasant, nicely dressed. Oftentimes it's a blue uniform, and to offer them a coffee and be very nice to them. And that person is a transplant coordinator, but I should say, a designated requester. Every hospital has a designated requester. It's part of the system to get organs. Now, getting back to how did I get into this, I started that special care nursery in 1963 at Cardinal Glennon Children's Hospital. It eventually was named in a few years as a neonatal intensive care unit, and I was the director of that unit until 1981. But what happened in 1975, I had a patient by the name of Joseph who was on a ventilator and wouldn't breathe and wouldn't move, and we did a brainwave test, which was flat, and it was interpreted as consistent with cerebral death, and that was what was written on his chart, and it's still written on his chart. It was suggested then to stop treating him. I continued to treat him. Joseph did get off the ventilator, and Joseph went to school, got good grades, ran track, played baseball.
Oh my God.
He's married and has 3 children at this time. But because of Joseph, I began to look into this this issue of brain death. Brain death was invented in 1968. Keep in mind, I was a doctor in 1968, heard about it, went on with my life doing the other things with neonatal intensive care, but when Joseph came along in 75, and then he continued to live, in a few months I began to look at the literature about brain death. Brain death is not based on any kind of data that would be acceptable for any scientific study. It would just be rejected. It was presented without any patient data. They did not do any experiments on dogs or cats or rats. They just invented it. And then the literature did not get any better. The next article in 71 studied only 9 patients, and they looked at the EEG. 2 of the 9 still had EEG activity. Conclusion: no longer was it required to look at brainwave testing before you declared somebody brain dead. It's just so awful how they did this. The largest study is the study by the federal government, the NIH, and it's called the Collaborative Study. 500 patients were entered, large study, but what happened? 44 of them didn't die. So what is this? Then you look at those who did die. 226, they looked at the brain, and 10% had no pathology in the brain. I mean, no pathology in the brain, and yet they were declared brain dead. The science behind brain death is no science. Brain death is, I use the term because it's the best term to describe it, brain death is a mendacity. A mendacity is a deception, a lie, and it was made up to get organs. Now, what do the people need to know? They need to know that everyone who is called brain dead is alive. None of them are truly dead. They get truly dead by the action that's followed. The action that's followed is to cut out their beating heart or other vital organs, or as in the case of Jahi McMath, where the mother said, no, you can't take the organs. Then they said, we're going to turn off the ventilator. So the mother said no, and she got on the television and pleaded for someone to help her. I went to California to help that family. Jahi McMath has a death certificate in California, but she's very much alive in New Jersey. I communicate
Oh my God.
on a regular basis with her mother as to her treatment, but she lives in New Jersey. She's has a death certificate in California. Now, there are these.
Dr. Byrne, let me just stop for 1 second. Let me just, so when I'm hearing this show in Texas, the one I was just telling you about, right? So the nurse says to the family, like the doctor, again, probably very nice. They described it as being very nice. She said, the doctor's going to come in. He's going to be very abrupt. I just want to forewarn you about that. So when the doctor comes in, the family describes it as, he just said, look, your son's brain dead. There's zero chance that he's going to recover. Are you saying that is a deception, because it sounded like it to me, to be honest with you, when I heard it? It just sounded like a setup. But is that what you're saying, sir?
It is a setup, and it is a deception. And just imagine, if you can, it's very difficult to imagine what these relatives go through. The relative of that patient, whichever it is, they're overwhelmed by the situation. They just had a terrible accident, or something awful has happened. They're upset, they're distressed, and they're presented with this thing. The ones that I get a chance to participate in are those who find me, and I have multiple patients who find me. Alan was declared brain dead in Montana, and I went there and helped him. He got treatment. He almost drowned July the 22nd. He went home from the hospital on December the 7th. I can remember the date because that's Pearl Harbor Day, but he went home on December the 7th. He lives at home in Montana with his mother and father and siblings. And you see, brain death is brainwashing. And the way you do, one of the ways you do brainwashing is you give people two nouns. Brain is a noun, death is a noun. And which one do they hear? They hear the one that's most impressive to them. And so they hear death, they hear brain death, they think death, when in fact, no, that's wrong. It's similar to life insurance. Life insurance has nothing to do with life. It only has to do with death. But they can't sell life insurance by calling it death insurance. And they can't. The only way to sell brain death is to participate in the lies, the deception. It's been one lie, multiple lies over and over and over, and continues to the present day, to where much of the medical system knows little or nothing about it. They have passed laws to get organs. The one that you might be familiar with is the HIPAA law. Everybody has to sign a document, theoretically, that your information will be used properly. But the HIPAA law has 14 ways that the government can get your information without your permission and use it, and one of the ways is to get your organs. The other laws, the Anatomical Gift Act and the Uniform Determination of Death Act, these laws are there to get your organs. The Anatomical Gift Act, which is passed already in 47 states, makes it presumes that everyone intends to be an organ donor, and it also has there that everyone has consented to everything to be done to them to test to see that your organs are good for someone else, and then to continue the treatment to keep the organs in good shape until they can find someone to give them to.
Oh my God! Are you saying so? My practice, right? We have a large practice. We just brought in HIPAA attorneys to make sure we're in compliance with all these things, and we sat through classes. Literally last year, I had my whole staff sitting through classes, make sure the computers are compliant. But you're saying that there's an aspect to this HIPAA law which I am not aware of. I hadn't seen. Again, there's so much to it, but when patients sign that.
Dan, you have to read it. And there are 14 ways that the government can get your information without your permission. The HIPAA law was passed in such a way. First of all, so far as the organ thing came about, it came as an executive director through Donna Shalala when President Clinton was the president, and it was at the time of his impeachment, and they issued the executive order, and the senators were all interested in the Clinton impeachment, paid no attention to it, and later when they got on the HIPAA law, they attached attach it to the HIPAA law. You see, before the HIPAA law, doctors and nurses did not give out any information. All of us were trained as soon as we got into medical school not to speak about the patient in the cafeteria, not to speak about the patient in the elevator. And whatever they did to us as doctors, they did it even more firmly with nurses, and it never happened. All of this was made up for other reasons, like the government, to get your information and use it without your permission. Now, that's a whole big thing in itself. But what I'm interested in is getting people educated that brain death is not true death. And part of the declaration of brain death, which is part every time, it's a procedure. They call it an apnea test, but it's really a procedure of an apnea test where the patient is doing well on the ventilator, but they take away the ventilator and then they disguise it by saying, we'll give extra oxygen, like down a tube through an endotracheal tube, as if there's any kind of law of physics that would allow that oxygen to go any further than at the end of the endotracheal tube and come right back up around it and do nothing to the millions of alveoli. That does nothing, but it's a way of selling it like they give oxygen, when in fact the other part of breathing is to blow out carbon dioxide, and the patient who can't breathe out, the carbon dioxide accumulates, the carbon dioxide goes up, acids go up, and both of those make the brain swell. They make the patient get worse.
So Dr. Burns, so you're saying, let's say, God forbid, you're in a situation where you have a relative, they're going to come to you and they're going to say, listen, we're going to test to see if this patient is brain dead. We're going to do this thing called an apnea test. But what they're actually doing is taking the person off of the ventilator, and it almost sounds like they're suffocating the person. Is that correct?
The person. And so the listeners must learn no to the apnea test. That's one of the things they must learn. They also must learn that when they go to the license bureau and they ask, do you wish to be an organ donor? They must say no, because the people have been saying yes on the basis that the organs are taken after one is dead. No, there are no organs you can transplant from a cadaver. You can get some tissues. Organs and tissues are different. The tissues they get, the cornea, the front part of the eye, they can get ligaments and tendons because they don't require a continual supply of blood and oxygen. So they can get tissues from a cadaver, but there are no organs you can transplant from a cadaver. Every organ that's transplanted is a healthy organ. Think about it. It must be a healthy organ. And where do you get healthy organs? You get them from living persons. Can you get a healthy organ, any healthy organ, from a cadaver? No, it's impossible.
No. I got to tell you, there's a simplicity there that I've just never thought of. You hear organ transplant and you're assuming, you're taking this from somebody that is gone. But you're right. I never considered it that this person would have to be alive for you to actually extract that organ. Otherwise, what the hell would be the point?
Yes. Now, Dan, the other thing that I'm very interested in is getting better treatment for these patients. One of the things that happens when the brain gets injured and swells, it stops making thyroid stimulating hormone, and it does this very quickly. And then when there's no thyroid stimulating hormone, there's no thyroid hormone being produced. And so these patients are hypothyroid, and the hypothyroidism makes for edema. We call it myxedema. And so whatever swelling they had in the first place, it gets compounded by myxedema of the brain. And so you have to give them thyroid hormone, which counteracts the hypothyroidism, which takes away some of the brain swelling, and then that allows the circulation to improve, and they have a chance to heal. And so my goal and objective for many years was to first to study brain death, and I studied more than 2 years just to learn the language. And then I've published in the Journal of the American Medical Association, 1979. I published in the Gonzaga Law Review, 85 pages, 240 footnotes, and I did all of this, and I continue to write articles, but more now for the lay people to learn and everybody to learn that brain death is not true death, and so my golden objective was to get people to know that. But now, more recently, we have a treatment that focuses on treating the hypothyroidism that they had, getting thyroid, and then we give other nutrients and common things that are used: riboflavin, folic acid, proteins. These are all things that are necessary for the brain to heal, and it takes a long time for the brain to heal. All of us know that if you cut your scalp, it bleeds tremendously, and
Sure.
healing is quick, but the brain is slow to heal. It takes at least 9 months, I would say, for the brain to heal. But of course, what they do is they want the organs. So and the other thing the brain does, the brain gets very quiet. It's called a penumbra, like a shadow. It gets very quiet and doesn't do anything. And that's when they're doing the testing, and it's so awful and shameful that they take advantage of the situation to get organs. The organ transplant industry is a multi-billion-dollar industry. $24 billion was billed for organ transplants in the United States in 2014. $24 billion in 2014. Multi-billion
Dr.
industry.
Dr. Byrne, you hear in China, right, that they harvest the organs of prisoners, or there's this Falun Gong, these practitioners, these religious practitioners, that they do the same for them. You would not think that something like that could go on in this country, but I'll just tell you a quick story. My grandfather was in Germany. He was in one of the concentration camps. Later on, over here, he got sick in his 70s. And I remember being at one of the hospitals, and we were with him, and the nurse came in and said, do you want to be an organ donor? And he said to me, there's no way I'm signing that. And I was thinking, Grandpa, I go, listen, this is not Nazi Germany. Sign the freaking paper. You know what I mean? And he's like, I am not signing that paper. And me and my sister were sort of making fun of him, because we're like, Dog, man, come on. This is not. And now I'm listening to this and I'm thinking, oh my God, he was right.
Yes.
He was right.
He was right. And of course, at 70, you would say, well, what good are his organs? The oldest one that I've read about is a patient 91. They took his kidneys, the people who are in the greatest jeopardy are the people who are 30 and less. They're in the greatest jeopardy. You might extend that up to 40, but anyone less than that, and if they're between 16 and 40 and they're unconscious and on a ventilator, they're going to get their organs. And so the whole goal and objective is to get organs, and they have to get them as quickly as possible, because if they don't take the organs, then what happens is they continue to live, like Jahai, like Alan, just to mention some of them, and helping a young lady, Takesha, in Canada, 27 years old, and she's very, very much alive. I saw her. She does move her legs. She's on a ventilator, and of course, in the system of brain death, moving of the legs doesn't count. So she's there moving her legs around and moving her toes and her feet up and down, and that doesn't count. They say that doesn't count. What they did in brain death is they really looked at really only three things. If they're unconscious, if their pupils don't respond, and a couple of other brainstem reflexes, and then that procedure of the apnea test that's so awful and cruel, and everybody must learn no to that. Those three things, anything else doesn't count so far as life is concerned. It's just a great big lie. Who in the world would ever think that it doesn't count whether your heart is beating by itself or not? And Jahai, her heart beats 100,000 times a day. She doesn't have a pacemaker. She doesn't have any medications, and it's been doing that since 2013. Yet she has a death certificate in California, and then somebody wrote an article not long ago that Jahi may not be dead. Come on, what are we being told, and how can we think? Anybody who thinks like that, they just have to have some other kind of order to their thought. Incidentally, every time they do this, they take the organs. The way they do it is they make an incision from the neck to the pubis, and they open up the chest, and the transplant surgeon sees the beating heart every time, and they all know what they're doing. They do it under the guise, well, this patient is not going to live very long. Somebody else can use their organs. We can make something good out of this tragedy, like the race car driver. And I don't want to comment specifically on that situation because I know little or nothing about it except what you've told me. I'm not doubting what you told me, but I'm just saying I don't want to comment on that. But what it's the same thing that happens whether somebody almost drowns. Incidentally, one of the very awful things that's going on is the overdose of drugs. They get more organs now from the overdose of drugs than they do from accidents and gunshot wounds combined. I live in the state of Ohio. There are 8 deaths a day from overdose of drugs, and they have to get their organs, and they have to get them quickly, and they do. And one of the things that was excluded from brain death right from the very beginning was if there's any question about whether there's any drugs, and of course they say, well, they didn't test for any. When the people get the street drugs, it has whatever it has in it, and many times they don't even know. You can't test, and who knows how long it takes to recover. And all of those.
So some of these people may be unconscious from the actual street drugs themselves.
Yes, absolutely, and they are. And now the campaign is to get Narcans into the hands of every policeman and the like. I'm not opposed to that, but the Narcan does keep them alive to get to the transplant center, and then the transplant center gets their organs, and so that's part of what they're interested in.
You know, Dr. Byrne, I got to tell you, when I thought about having you on, I've actually had a couple of nights up having listened to you, just having a rough go of it, because I thought, man, ethically, like I do know some people that have lived because of transplants, and then I'm hearing this. I am so glad that I've had you on because it's very upsetting to hear this. It's just like, oh my God, I mean, what the hell have we become?
Oh, Dan,
I just don't even know what to say.
I am happy to see someone who is doing well after their organ transplants. Incidentally, their life changes is what happens when they get the organs, because the anti-rejection medicine causes them to have lots of other diseases, including cancer and infections and other things. And I read an article not too long ago that 40% of organ recipients have some dysfunction of their brain, and so it isn't that they get an operation and then everything is okay. And so, but I'm happy that they continue to live, but I'm very concerned about the one that they took the organs from. Even when they give one of 2 kidneys, the long-term follow-up shows that the donator of one of those kidneys have an increased incidence of heart disease. And if you know about the heart in relation to the kidney for controlling our blood pressure, it doesn't surprise me because if you heart continues to make whatever it makes for 2 kidneys, and now it continues to do that enough for 2, but there's only 1. Who wouldn't think that maybe something would go wrong with the heart if they took one of those kidneys out?
No, absolutely. So, Dr. Byrne, I heard you talk about the fact, which was really disturbing to me, is they don't And when they do take these organs, they don't particularly anesthetize these people. Is that correct?
That's correct. Now, at least that was correct for many years. They would just paralyze them. They have shown now in more recent times that it's better to give them an anesthetic because then the organs are in better shape. And so they just paralyzed them and did not give them anesthetic. But in more recent years, they've started to give anesthetic in the United States to
And Dr. Byrne, what is an average person worth in terms of their organs? I mean, if we're talking, obviously we're talking finances here. So what are we talking in terms of value?
A donor is worth between $1 and $5 million to the transplant industry. And there is no transplant industry without healthy organs. And so and everybody must learn these things that we've talked. No to the apnea test, no at the organ transplant at the license bureau, and they have to learn. The other thing that I've learned through all this, Dan, is when a child becomes 18. Then they're considered an adult. And if they don't have a power of attorney that designates their mother and father to speak for them, and they get into this situation, what I've had happen is they go to court. The young man is at college in California. His mother lives in Texas. And before his mother can even get to California, they've gone to court to get a power of attorney. And then power of attorney or the guardian is appointed, and that's another attorney. So everybody must learn when they get to be 18, they must have a power of attorney that designates their mother and father to speak for them until they get married, is what I would say. But they have to have.
Wow, this is an aggressive attack. This is not a benign type of situation. I mean, it almost comes down to who owns your organs. I mean, it almost sounds like it's the government to some degree.
It is the
that
government.
has taken control.
It is the government. Yeah, it is the government. The government's in charge of all of this, and the current system of the government is the Secretary of Health is the one who makes all of the decisions for health care for CMS, which is Medicare and Medicaid. And then the private insurance companies all follow that. And then the Joint Commission comes along and makes sure that all of the hospitals have these procedures in place. You know, all the hospitals have a policy that says that if you're unconscious and on a ventilator, the organ procurement organization is notified at that time. And all of that's in place in every hospital, and the Joint Commission makes sure that it's in place because that's the system that's set up. And it is run by the government.
Dr. Byrne, I am so glad that I had you on this show. I really think that the information you're putting out is important for people to know, if nothing else, so at least that they can make an informed decision. You know what I mean? I would hate to see a family go through a tough decision and then hear this show later and realize that this other information was available. And so part of being an informed consent, if you want to let somebody do that, if you donate to organs and you know and you understand all these concepts, that's different. But if you're never presented with this information, that's a crime. That's really not a very, very nice thing to do to somebody. Dr. Byrne, we're going to end the show right about now. Is there anything that you would like to say that we haven't covered?
Well, you must discuss this amongst yourselves, and people must say, I do not want to have my beating heart cut out because I know that will kill me. And they must learn at the License Bureau to say no. And so these things are necessary. Go to our website. It's www.lifeguardianfoundation.org, and you can get more information, and we will happy to send out to you a medical card that you can carry with you that will say that you want to be treated and you don't want to be an organ donor.
Wow, Dr. Paul Byrne, I want to thank you for a very, very powerful interview. I really appreciate you being on this show, sir.
Thank you very much, Dan, for having me.
This episode is sponsored by New Jersey Foot and Ankle Center in Oradell, New Jersey. Remember, when you have a foot problem, you've got a foot doctor in the family. Weekend and evening appointments are available. Call us at 201-261-9445. Once again, that's 201-261-9445. Thanks for listening. Check out the show notes over at drdanspeaks.com. If you're loving the show, head over to iTunes and leave us a review, and we'll catch you next time.